Diabetes Management for Life. As the number of people with diabetes grows, ISJ Regional Medical Center is working to help patients manage their disease and prevent other diabetes-related health problems.
It's estimated that almost 24 million people in the United States have diabetes, and of those 24 million people, about a quarter of them don't even know that they have it. So it really comes down to early detection, proper ongoing treatment for individuals who have this illness. Emmanuel St. Joseph's is continually looking at how we can improve the care we're providing to our patients with diabetes. This is in an effort to then ensure better outcomes for our patients, again, in the form of less hospitalizations, less money needed for medications or other complications, and a better quality of life.
Minnesota Community Measure, as well as Emmanuel St. Joe's, has adopted the all or none measure as a way for us to compare ourselves across systems, across providers, across the state, actually. And the all or none measure means that a patient with diabetes has met the 5 measures that have been set out by Minnesota Community Measure as a standard of care. One of those is having an A1C under 7, and that has to have been done in the last 6 months. Having an LDL under 100, that has to be done in the last 12 months. A blood pressure under 130/80, measured again within the last year. Is the patient on aspirin if they're 40 to 75 years old and there's no contraindication, and then are they tobacco-free? So for a patient to be considered meeting the criteria for all or none, they have to meet all of those 5 measures. So that was one of the main goals that we set out when we started this process team, and we were at about 10% in August of '07, and our goal was to reach 20% by August of 2008. And we are at 20% now, so we've doubled our all or none rate within the last calendar year, and it's been a nice, consistent gain. And again, each of the sites need to be congratulated for the work that they've done.
The vision that the diabetes process team has is that no matter what door a patient walks into throughout the Emmanuel St. Joseph's system, that they will receive the same consistent and highly reliable care, no matter who they're seeing, again, no matter what clinic that they are being seen in.
What it takes to deliver the vision. Have an active diabetes team at every site. Include team members with different clinical areas of expertise. Automate care whenever possible. For example, ISJ Regional Medical Center has developed a database of information to quickly tell providers which patients are diabetic and how well they are controlling the disease. Compare ourselves to each other and share successful practices.
We would really like to acknowledge the fact that all of our sites, Waseca, Springfield, Madelia, St. James, Northridge, Eastridge, St. Peter, Le Sueur, all have active diabetes teams at their site that meet monthly, at least monthly, depending on, of course, what works for their site, who have grabbed this project and really made it work.
The best care is personalized care.
Continuing to work with a healthcare provider, your physician, your diabetes education team is going to help you manage your diabetes so that your complications are less, you have a better quality of life. It's that ongoing care that helps manage chronic disease. I can think of one example where we really feel like what we've been trying to do over the last year has really come to make a difference for a patient at the point of care. We had a patient who was a routine patient at our clinic, had a primary care physician at our clinic, and had been seeing her primary care physician at our clinic on a regular basis. She had been working with that physician on managing her blood pressures. One of the key pieces of diabetes management is to have a blood pressure under 130/80, and hers was not. She'd been working with a physician and had been in to see the physician about a month ago, and they had made an adjustment in her blood pressure medication, and the plan was that she was to come back to the clinic for just a blood pressure check. In the interim, she came in to get a flu shot, and her primary care physician's primary nurse noticed that she was in the clinic getting her flu shot, and noticed that the patient was there and said, "You know what, Mabel," I'm not even sure what her name was, "but I don't want you to leave the clinic today without getting your blood pressure checked. That was part of what we wanted to do, and as long as you're here, let's just do that." With that happening, it really told us that for one thing, the physician and that primary nurse had really developed a team concept around taking care of those patients that were their responsibility. They knew their patients, they knew what they needed, and it was a very personal touch for this nurse to be able to say, I know you, I know what you need, and I can deliver that for you right now.